Hi, Denise Morning here. Today I'm going to take an ethical stance and discuss a case about pain management. The case is entitled Walking the Tightrope. Undermanaged pain makes for an unattractive patient. We have an 85-year-old widow who experiences chronic pain from osteoarthritic and osteoporotic conditions. Her family places her in a nursing home because she was medicating herself incorrectly at home and not adequately managing her activities of daily living. The family and the physician are reluctant to give her strong pain medications because they don't want her doped up like she was before, but this results in her being bedridden at the nursing home. Her sister finally calls the state regulatory agency to complain that the staff is neglecting her and not taking care of her pain. So the doctor finally agrees to try a prescription strength NSAID, which she takes for 2 weeks, but then it leads to a severe GI bleed that she has to be hospitalized for. So when faced with an ethical dilemma, the following are some useful questions to consider. What is the action or inaction that is the cause for concern? The action here is that the patient who is experiencing chronic pain is not being given the correct type or amount of pain medication. Who or what may be affected? To some degree, all people involved in this situation could be affected. The provider, the patient, the son and the daughter, the sister, and the nurses at the facility, but no one is more affected than the patient is. How will they be affected? Well, if her pain's not properly managed and she has to remain in bed all day, her conditions are going to get worse. What actions might be taken and what would the consequences of these actions be? The actions that could be taken are to try out a numerous variety of pain medications that are available these days at differing dosages. The consequences might be side effects of those medications, but because she's in the nursing home, they can be managed properly, and the correct dose, medication dose and interval can be discovered for her. Can anything be done to prevent this from reoccurring or to minimize the severity of the consequences? And yes, again, because she won't be managing her own medications, the consequences could be limited and hopefully prevent her pain from letting her experience, the rest of her life. So I believe the underlying principles of ethical patient care in this situation are the principles of beneficence and the principle for respect and autonomy. So the principle of beneficence states that medical practitioners should act in the best interest of the patient. They should prevent harm, remove harm, and promote good for the patient. The relevant harms to be prevented or removed may include pain and suffering, disease, disability, and death. And similarly, the relevant goods to be promoted may include well-being, health, proper functioning in life. So we're discussing pain, and the last time I checked, pain is considered subjective. So as this woman is stating she is in pain and is unable to do anything but lie in bed all day, I believe that not giving her adequate medication to control this pain is not preventing or removing harm, but potentially causing more harm because of the risks of muscle atrophy, bed sores, and depression, as well as making her osteoporosis worse by not being weight-bearing. The principle of respect for autonomy states that capable patients must be allowed to accept or refuse recommended medical interventions. Autonomy is defined as the capacity for self-determination or the capacity to make one's own decisions. In the healthcare context, this capacity involves the ability to make and communicate healthcare decisions. Now, this case does not state what the patient stance is in this situation or what she has stated specifically, but if she is of sound mind and was previously ambulatory, I do not feel like her autonomy is being considered if the pain is so great she is bedridden. If she is still able to be autonomous and having stronger pain medicine will help her with that, then the family and the provider need to consider that. The ethical standards that relate to the case include the utilitarian approach, which is the idea to produce the greatest good and do the least amount of harm. And like I stated, since she's in a nursing home, her medications and meals are now being managed by the facility, so the problem of mismanagement and overuse on her part has been corrected. Instead of taking away her pain medicine completely, they should work to find the correct dose and the correct interval for her to be able to stay active, but also not be high and non-functional. The rights approach is from the belief that humans have a dignity based on their human nature or on their ability to choose freely what they do with their lives. On the basis of such dignity, they have the right to be treated as ends and not merely an ease to the ends. In my opinion on this woman's 85 years old. She's a widow. She's lost her husband. Her family has placed her in a nursing home, and she suffers from chronic pain. If stronger pain medicine is what it takes to make her remaining time on this planet more tolerable, then so be it. It's her right, as long as she has sound mind, to make her own decisions and to be treated properly. And the common good approach, which suggests that the interlocking relationships of society are the basis of ethical reasoning, and that the respect and compassion for all others should be considered, especially the vulnerable. And the common good in this situation would be to properly control this woman's pain so that she's not constantly complaining about it, and she's not miserable. I believe if her pain is corrected, she would stop complaining, and maybe her son and daughter would visit her a little bit more often, and the nurses would not find her so difficult to deal with and hard to please. And that might make her quality of life increase, as well as the quality of life of the people around her. So that's my stance on this case. Let's help this woman out. Who knows how much time she has left, and who are we to decide what she is and what she is not experiencing. So those are my thoughts. Thank you so much for listening, and I look forward to your comments. Bye.